This is the second in a series for AmplifyChange grantees and applicants who are planning an advocacy campaign. The series takes you through a step-by-step guide to facilitating the development of an advocacy strategy. In Part 1, we introduced some techniques to help you identify a common problem you want to tackle together regarding sexual and reproductive health and rights, draw out and prioritize the causes of the problem. In this film, we will illustrate how to lead a discussion with your colleagues and fellow advocates to agree on clear objectives, identify decision makers, and analyze stakeholders. Step 1. Once you know exactly what the problem is, you can clarify the objective or objectives you want your project to achieve. Consider the mechanisms by which the change might be made. Will it require a change in a law, such as the Criminal Code or Bill of Rights? Perhaps it's not so much about law, but about the development of a policy that increases government expenditure. It might be about establishing a new budget. It may be a question of amending or creating new regulations that govern a profession. This is where you might need to consult experts. Sometimes identifying the laws, policies, budgets, or regulations that govern the situation requires the specialist research of a political scientist, senior health or education professional, or a legal expert. You can also find a lot of excellent resources online. Look at what the law, policy, budget allocation, or regulation says today and how exactly you want it to change. Your group should ensure that they have a clear description of which particular words in the law need to be changed or added, and what you think they should be changed to. Be as specific as possible. Step 2. Once you have defined what outcome you want to achieve, it is time to identify where that decision is made. Experts may come in handy in identifying where a decision is made. Is it in the National Assembly? Is it at the government ministry level? Is it within a professional association or standard-setting agency? Is it at the national level or subnational level? Step 3. Now that your group is agreed on how the change could be made, you should decide who you need to advocate to. Start by asking, who can change the situation and how can we influence them? Bring together as wide a group as possible from your organization when doing this to draw on as much knowledge and as many relationships as you can. If it's not possible to have them physically present, make calls or send emails as necessary to obtain this information. Many advocates find that setting up a WhatsApp group is really helpful for facilitating communications within a coalition or network. Within the appropriate body, can your group define the typical path of a proposal to change a law, policy, budget, or regulation? If so, you should ensure that everyone involved in your advocacy team has a clear understanding of the steps required to change the policy, from committees it must pass through and how approval or changes are made at those stages, to how many votes would be required to pass it. Now, put the decision maker or decision makers on your advocacy issue in the middle of a sheet of paper. Around them, write the organizations and individuals who will influence their decisions. In a wider circle, write the organizations and individuals who will in turn influence the decisions of the first rank of influencers. Then, color code them depending on their level of opposition or support to your cause. Bringing the knowledge of the maximum number of people to bear on the mapping process will result in a more effective stakeholder map. You can now decide which people and organizations you will need to advocate to or use as allies in order to complete the various steps to change that you have identified during the process of analyzing how stakeholders will make decisions. Your earlier work on ensuring a broad understanding of the mechanisms by which the change will also be made will help you at this stage by clarifying where to prioritize your resources. For example, an AmplifyChange grantee advocating for the introduction of comprehensive sexuality education into the curriculum might want to focus on influencing members of a committee rather than members of the parliament or legislature, although this may come in handy too. It all depends on your context. This is also an appropriate time to think about what does not fall under the scope of your project. It is easy for small groups to take on responsibilities that are too broad. Discuss with your colleagues the boundaries of your mission. Before you begin, you should be as clear about what you are not trying to accomplish as what you are. You might have to design multiple stakeholder maps for decisions made by a range of people at various stages of the process, or for decision makers in parts of your project addressing different causes of the problem. Remember, to keep returning to your plan, you'll need to consistently update it as the context evolves and as you develop new links and learn more about the stakeholders involved. In Part 3 of our series on advocacy planning techniques, we will offer you tips to develop messages, plan tactics, and assess risks. And we'll show you how to translate your advocacy plan into your AmplifyChange grant or application.